let's go into the first part. Okay, so I always start with this, which is why I can do it for you. So I'm going to do this really fast, who I am. Most of you should know I wrote the Handbook of Geriatric Care Management, actually with a whole bunch of my colleagues and friends writing chapters. And that's going to go into its 5th edition. I'm the author of Care Managers Working with the Aging Family, which I must say is really a great book, because aging is not, it's about the aging family, and mostly you're going to have dysfunctional families, and you've got to enter that family and get care for the older people. And who is going to stop you? The family itself, if they're dysfunctional. And so you need to know family systems, and that's what it's about. And I wrote Mom Love You Best, which is about the most terrible offenders in the aging dysfunctional family, siblings. They really try to stop you from helping their parent, even though they hired you. That's how crazy these families are. And I have my Geriatric Care Management Operations Manual, which has been out for about 10 years. So that's who I am, and let's get started. This is Keith. And Keith he's waving to you. Keith and I taught together at the University of Florida, and he is still there. He's head of the Geriatric Care Management Certificate Program, and he's a part of the awesome Florida Aging Life Association group, which is really fabulous. And they have a horrible problem down there in Florida, as I think you almost well know. And I would say, personally, a bad governor. And he belongs to the National Council of Dementia Practitioners, too. I'm trying to move this around and get rid of it, but it won't get rid of. Let's put it up here. Okay, so that's Keith, and he is the back end, and I couldn't do it without him. So why am I doing this? I'm doing it to help you, but the most important reason that I'm doing it is because I am so frustrated with what's going on with COVID. With mixed messages, because mixed messages are being given out daily by a person I won't name, but the federal government, the states, the counties, the local cities, all have different messages about what you should do about COVID. And this is especially important for aging families, because who are the most vulnerable people in this epidemic? Aging families. And so the aging adult children have really no concrete path to figure out how to keep the elders safe that they love so much. And so who can do this? You can do it, and that's why I put this together, because you can do the research, and I'm going to show you how to do that, to advise people on the best scientific and healthcare basis for aging families to navigate to safety. And you would do that on the web, and I'm going to show you how you can do it. And we're going to go through many of these, and fast too, many of these packages that I developed with my wonderful geriatric care management class and business class. We did it in 3 weeks because we needed to get it done to keep them afloat. So the first product is long distance families, which really have a terrible time with the senior members sheltering in place. The second one is for a local family with a senior who's sheltering in place. Neither of them have COVID yet, but they have to shelter in place. The third is for a local or a long distance family who is recovering at home. They never wanted to go in the hospital, and so they're recovering, and they are actively in a state of COVID. Product 4 is for the long distance family where the older person has gone in the hospital and now they're discharged. And what should they do? And product 5 is for the local family, same thing. And what's the problem here? There's no clear direction. So you, as a geriatric care manager, which you are a navigator, you can make this happen. And what are you going to do? What are you going to use to do this? You're going to use telehealth. And what's telehealth? So telehealth is the use of technology to access healthcare remotely. That's remotely is the key word here, and manage your healthcare on one of these screens that you can see here. These are technologies that CMS, which is the Medicare federal organization, have liberalized because of COVID to allow people who can accept Medicare, which you can't, to use it in many, many more ways, because doctors, people can't just go see their doctors anymore because they're sheltering in place. So doctors and nurses, PTs can use it, but you, the care manager, can use it too. You just have to use it in a different way. And you can basically consult with older people, but basically you're not going to be consulting with older people, you're going to be consulting with their adult children. So why should you do this? Why should you do what I just told you to do? Well, first of all, GCMs want to know how they should, in the midst of COVID, respond, recover their business, and reinvent their business. And they need to experiment to do this, to lead customers to them. So telehealth is the answer for you to bring new customers to yourself. And you will need them, because things are going to get worse, I think, as you all know. When winter comes and the flu crashes into COVID, it's going to be a horrible winter of our discontent. So what's happened to us? COVID has wiped out our normal too. It's wiped out everyone's normal, but especially ours. This woman that's got her hand on her head could be any one of us, because our normal cadences and patterns are gone. I mean, what happened to having birthday parties with everybody there, eating the same cake? You can't do it. What happened to going to the beach? You can't do it. I mean, all the things you could do in summer are gone. Of course, a lot of people are doing them anyway, and that's because of the mixed messaging, which is causing COVID to get worse. So what do you want to know? You want to know yourself, how do I recover my business? But most of all, how do I service my customers? And how do I become customer-centric, really, caring about your customers, and at the same time revitalize your business? And this is the way to do it. So what I want you to do is to be able to create, we got to go back here, create a customer's or client's safe new normal. And this is the time for the GCM to be an aging family and adult children customer focused professional. And that's what you can be through this consulting. You can be a resource to customers or clients and provide them with, and this is really important, science-based insights and information. You can do that, and you just do it through the web. You can be empathetic towards your clients and show your clients how you feel. And that's what, your clients and your future customers latch onto, that you have empathy. And, you do have empathy because you hopefully want to take my advice and use this consulting to help those poor people out there that don't know what to do, because there's such mixed messaging out there. And beyond that, you want to build trust and affinity to show that your customers that you are a caring professional. And how do you do that? Well, this is one way. You want to use HIPAA-compliant telehealth. So telehealth is basically, it's a product that you buy. I'm going to next show you, Zoom is one. We're on a telehealth product right now. But a HIPAA-compliant telehealth product is what you want to use, and that will allow your clients to build trust in you, because you're going to assure them through a HIPAA-compliant telehealth product that you never share their medical information. And that's a really important thing to say. And, you know, what is HIPAA compliant? It's just the HIPAA thing that we all pay attention to, the Health Insurance Portability and Accountable Act. And all it means is that you're safeguarding medical information. You're not going to share it with anybody. So if you use that, that's really important. And, you know, you need to use HIPAA compliant, because at that point, you're both giving and receiving healthcare information that's protected under HIPAA. So what are some of the choices? Well, Zoom is one, and I use it and I like it. But I want you to, this was done by one of my students, Helen. There's about 7 or 10 other choices, about 8, and I only have 5 here, and I'm not going to go through them, but you will get the copy of this webinar and you can see them. There's several here and several here, but you can see that Zoom is the most expensive, and if you look at the others, they're less expensive. So you do have choices, and they're all HIPAA compliant. So that's, you know, a way to go. So the next step is, well, how do I bill for this, Cathy? I want to, you know, I don't have a lot of clients anymore, and, you know, I want to be able to make more money. Well, that's what my students felt. So what you have to do here is bill in advance. Some geriatric care managers will already do that. They'll take a large deposit and then, you know, just sort of bill down, and when the deposit runs out, that's like an attorney. But this is what you need to do. You need to bill in advance, and you need to, first of all, figure out an hourly price for your program, and my suggestion would be just whatever your regular hourly fee is. It's the easiest way to do it. And then to offer, I suggest a choice of 1 hour, 3 hours, or 5 hours. Now, this really depends upon, do they want, you know, usually they'll only want one of those 5 because that's the situation their mother or father are in. But, you know, they make that choice, and then, you know, you have to keep track of the time, and when their time is up, you know, either bill them again or you end. And so that's how you do the billing. I would definitely use credit cards. And the whole reason you have to do it this way is Medicare doesn't cover you. It's still, you know, CMS just came out with brand new rules. If any of you belong to ALCA, which I hope you do, ALCA, Regina Coran, who's great out of Baltimore, watches you know, what's happening in Washington as far as aging is concerned, and she just sent out a whole new CMS expansion of telehealth. I mean, it still doesn't cover us, but there's new expanded telehealth coverages. So that's how you bill it. And so what you do is you create products, and I just showed you the products that I think you should be using. And then each product has a procedure underneath it, and we're going to go through procedures, but like, for instance, an advanced directive is a procedure, right? And so you want to explain if they're sheltering in place. They should have advanced directives done, because they're old and vulnerable, and they could get it whether they're sheltering in place or not, and be in the hospital right away. And what happened when New York was, you know, going through its worst time and the hospitals were surging, the admissions, the whole hospital was filled with beds of COVID, and the admissions directors were not taking the advanced directives down, and a lot of people were dying and their last wishes weren't there. So you need an advanced directive, and what you're going to do is show them, and I have it in here, you know, what to do about an advanced directive. So that's a procedure, and that would be under, say, sheltering in place. So each product, you know, should have I would say 16 to 18 procedures. Each should only be about 1.5 pages long. You don't have to worry about making it really long. It needs to be written in user-friendly language, not a bunch of medical and psychosocial jargon, because it's going to very anxious, families. You write an introduction about how you're going to help the family in the beginning, and I'm going to show you some examples to show. And then you've done the research on the web for advanced directives, let's say, and you're going to write out the directions about what is an advanced directive and how to get it. And that shows something I was talking about earlier, that you are empathetic and you want to show your customers you care. And that's why you write the introduction, that you hear their pain. And I'll show you some introductions. So the next step is to do the research on the web on whatever procedure, the procedures you think, and I'm giving you examples of many, should be under a product that you say you're going to do sheltering in place for local people. And don't copy the procedure from the internet, but write it and use user-friendly terms, but only use the most trusted scientific health-based links. And I would suggest, or I would say, don't use any but CDC. Johns Hopkins is really great, or other reputable sources. The Red Cross is a great source, but you'll see a lot of sources up there, and it's relatively easy to do the research. It's time consuming. You're going to have to get people in your office to do it. The way we were able to do it is my students did that kind of research. They all took 2 procedures. We had 50 all together, and it was easy when we did it all together, and then I had outlined it and yada, yada, yada. So let's start with a product. This is product number 1. It's the long distance family, and they are sheltering in place. But long distance people have really hard times. Families live far away. This is like an introduction here to be empathetic. They live far away. The average amount of miles that they live far nationally is 450 miles because they have to fly. And the average time that takes to, get back to the parent, and it's, 7 hours by the time, it's even hard to get on airplanes now. But, waiting in terminals, getting on the plane, getting off the plane, yada, yada, yada. They also have the highest annual expenses. It's almost $8,000 a year compared to local families who live right by their older relative. So it's expensive and it's hard. And but they want to keep, their number 1 priority is to keep their loved ones safe. And I'm 75, my husband's 80, and I can tell you I have, daughters and sons that, they're really worried. And, so adult children it's really important that they protect their families. But long distance families are like Ginger Rogers, if you know Ginger Rogers and Fred Astaire, because they're doing all of this. Like Ginger was dancing like Fred as well as Fred, but she was dancing in high heels. They're dancing in high heels while the local families, they're in their flats dancing, because they've got to do all this remotely, which brings you in as a geriatric care manager, because they have to find other ways of supporting their family member who's in another town, probably miles and miles away. So caring for the caregiver is the number 1 procedure that I would start any one of these products, because as geriatric care managers, caregiver burnout, caregiver depression, if the caregiver goes, the whole case really usually goes. So the caregiver needs to learn to take care of, and that's a coaching skill that you can have. And these are just some basics. I mean, I'm just starting out. I'm not going to go through all these, but, wash your hands, et cetera, et cetera. But it gets you know, when you go into the procedure, you need much more, because at the end of the day, they literally have to take all their clothes off and wash them. They have to completely shower themselves because it's COVID. And when they get home, they have to decompress. So you need to give them all those directions. It's probably going to be more than a page and a half. And they need to find a caregiver support group. So you're perfectly poised to tell them this because you're a professional that does this. And, you know, start there because you want them to be strong to get through this. Now, in the procedures, I've put things together to make this easier. So these are safety procedures that I think are really important. First of all, you've got the safety of the caregiver, which we were just talking about. So they have to know infection control to protect themselves from COVID and the older person they're taking care of. Plus, they need to know about caregiver stress and how to deal with it. That can come from you. They also need to know technology. There's huge technology out there for long distance care providers now. For instance, there is an electronic pill dispenser that the long distance or even the local caregiver, they can dispense the pill from their own house. So you need to, you know, do some research about technology that can make their stress less. There's the safety of the caregiver and then the safety of the house. You have to, you know, scrub down the house with infection control, and you have to know the difference between cleaning and infection control. And that's a procedure in itself. And, you know, it's easy to come up with that on the web. And you do it, you know, like you do a home safety assessment when you first take on a case. You have to, you know, usually you can't go out because they really don't want you to do that, but you can tell them everything to look for, because you have to make sure that the house is safe against falls, against fires. Do they have a fire extinguisher? Are the meds safe? Is there an escape route, and basically safety in every single room. And then what you have here, and we're living through it now, is safety against other disasters. Because what's happening now, Riverside County in California, I don't live down there, I live in Santa Cruz, but California's burning up again early. And so you have a wildfire on top of COVID down in Southern California. And on the East Coast, as an example, in you know, I was just talking about Florida, but Charleston, for instance, closed all of its you know, places where people could, you know, the schools and everything where people could remove themselves and be safe because of COVID, because everybody would get infected. And so everyone had to stay home, which is not the safest place to be. Shelters. So, you know, basically you have things like hurricanes through earthquakes. And so you need basically from the Red Cross a whole safety procedure. What you do, and essentially in a natural emergency when you also have COVID. And then there's the safety of an older person. And so there's technological safety. You want to have home monitoring in case, you know, there would be a break-in or anything like that. Emergency response if the older person falls, you know, so that they have a watch, or, you know, there's so many new emergency response technology out there. And then safety from COVID. You know, there are rules, really. No visitors, wear a mask, cleaning, you know, disinfect everything, and then self-isolation. So safety procedures, and these are all subbed out, are really important to put into all of this. And what the long distance family usually needs is somebody to monitor. So one of the procedures needs to be about a geriatric care manager. And what you want to tell them is what a geriatric care manager can do safely under, you know, COVID restrictions, like wearing a mask, taking your temperature. You know, you should have protocols for all of this already up on, you know, your website, and that your agency has a policy about safe home visits for both care providers if you do employ them, and for the geriatric care managers. that you have, you know, if they need, and I'll go through some of these jobs, if they need care providers, and you do provide care providers, or you know, you contract with a home care agency, that you can, you know, get, you know, someone in to clean, someone to cook, and they will all be safe. They will all follow these protocols, taking their temperature, you know, et cetera, et cetera. And then a link to find you, or if you want to just be general and say a link to ALCA, to find out people in your community that are geriatric care managers, or a link to the AAAs, so that you're giving everybody choices. So you want to do a whole procedure about geriatric care management, because especially, so we're going to do a little poll now, just to break this up because it's longer, and Keith's going to do that for you.
Yeah, let me go ahead and get this started then. And you should be able to read that there on your screen. And choose one of the best. All right, we have numbers coming in. Kathy, can you see those numbers?
Yeah, I see him.
Okay. All right. We got a few more to go here. All right. Looks like we just about finished up. All right. So you can see the overwhelming amount it was about 44% would choose all of those resources.
Great.
Let's see, it looks like we have almost a three-way tie for local recovering post-hospitalization. Well, numbers 1, 2, and 5, it looks like they're pretty much tied at, well, it says 29%. Yeah, they are. How about that? Okay, they are tied at 29%
Good.
each. And so there's your results of your first poll.
Okay, great. Thank you very much. Okay, we'll get out of this. Okay, so we're going to go into product number 2. And this is a local family. A lot of, God, go away. This is a local family, and in this procedure, a lot um, is copied from long distance. But you know, they have, you know, they are not Ginger Rogers. They're Fred. They're dancing in flat shoes. They only live a little bit of far away, so they can offer direct care locally, but they still will need procedures, and advanced directives, which again I will go over, as a procedure they need, because again, they could still get COVID, even sheltering in place, and end up in the hospital, and they want their last wishes if they do die. They should have, and everyone should have, this should be a procedure should all use, a go binder. And that really came out of wildfires, I think, out of California, because you took it and ran before the fire ate you up. And it's, the go binder is, if indeed you know, in an emergency you have to go to the hospital, the advanced directives in there, all the family connections, a background about you medically, and so you can take it to the hospital, and the hospital admission can use it really quickly, because you can't go into the hospital, the care manager, nor the family. So there's a procedure you need to do about a go binder, and you can find them. We've all found them, my class and I. The supplies you need for the rooms in the house while they're sheltering in place, because that again is, you know, CDC does it, to, you know, exactly what kind of supplies you need to keep on hand, you know, both for you know, the daily part of sheltering in place, but also that emergency, because more hurricanes are coming, more tornadoes are coming, and California is still going to have wildfires. So you have to have essentially a 2-week supply of food. Um, Symptoms to watch for, that's really important. You need a whole procedure about that. And how to eat, this is really critical, how to keep an older person socially connected, because we're all isolating now and we're all depressed. In some way or another, everybody's life has just blown up and we mourn it. We're depressed about it. And we know how these poor older people feel because they're isolated and they need something to do, just like you need. What I get to do is I get to do this. This is fun. I do a lot of other things, but I love to teach. However, you need to think of social connections, and I'm going to go over that for you, but you need a whole procedure for that. And then it takes a village. You need to know how to share the care and technology to arrange, for instance, if you don't want to order meals in, all the friends could drop off meals, just like they do for newborn mothers. They leave them on the porch. They don't go in. Send cards, call, anything like that. And I'm going to give you some Caring Bridges, one that I use myself. My husband just had open heart surgery in the cusp of COVID at the end of February, and I use Caring Bridge. I would highly recommend it. It's a way to organize people who love you. And then finding test sites, which is a row to hoe, as you well know, because testing, half the problem here. Testing, the federal government didn't help us. It's only the states. And so there's less testing now than there was 3 months ago. So finding testing sites to find out if you even do have COVID. So you have to go to your local health department website and find that. And then preparation for the delivery of meals, if that's what you're going to do. What restaurants locally are going to be brought in, or would you suggest, or delivery sites. So what you have to do is embrace technology. And what I would suggest is you would use Alexa. And Alexa, could you tell me if we could use you? Let's see if Alexa will talk to me. Well, Alexa, are you there?
Yes, I'm here. I listen once I hear the wake word.
Can you make calls? Can you call for me? Well, she's not answering that. But Alexa 8 is a great technology to use for older people, because even though she's not being responsive right now, the older person can make calls on it. I mean, it's a really uncomplicated, it's designed just for seniors. It's an uncomplicated technology where you could listen to, I listen to the favorite music that I like, it's like the radio. I don't use it very much. I'd rather think things out, but it's really wonderful for older people sheltering in place. And then you need home monitoring systems. I already talked about that, because the local person and the long distance person want to know that no one's breaking in, that the house is safe, their loved one. And then you need healthcare technology, and that's, you want a medical alert, like, used to. Now it's, they're very easy. They're in your phone. You get it in Jitterbug. Wearable activity tracer if, the person, your loved one wanders away. And electronic pill dispensers. There's many, many more, and you have to do the research on the web. But there are 3 procedures that you want to do. And go back here. Advanced directives. So here we are. So just like I said, if the older person does get affected and they go to the hospital, there's a possibility that, the whole hospital is going to be surged out. And the staff are going crazy, and the advance directive doesn't get there. Or so a go binder with an advance directive is really important, and you need to make sure it's done, because only 50% of older people even have it done. So if they don't have it done and they're already sheltering in place, on the web you can find under advance directives, under each state has its own very fast advance directive form. And so you can just get the advanced directive form from the state. They'll, email it to you right away, print it out. And, because you don't have the time to go to a lawyer, and the lawyer probably doesn't want to come to you because he'd get or she'd get infected. So there's a fast way to do it, but hopefully they already have it. But you need that, and every single of these products needs that. So this is product number 3, and that's the local family member recovering from COVID at home, not the hospital. So these people have never been hospitalized. A lot of people don't want to go into the hospital, don't feel like they need it, or they're scared to death to go there. And so the family lives locally or long distance. I'm going to put these two together. And they may have their loved one living with them, which is dicey because kids are super spreaders. Or they may be living at home, which is probably the safest, living in their own home with private caregiving. And that would, generate a geriatric care manager. That would be really important, especially for the long distance care provider. And if you do home care, you could place, care providers there. But they need the same information from you as a GCM as you would normally give it out. And then they, have an additional stress, the adult children or the local families, because that's the old sandwich generation. They're trying to keep their kids safe because the feds want them all to go back to school. So they're homeschooling and trying to take care. I'm laughing because it's so insane. It's so crazy. But the family is, the sandwich generation, the sandwich is just mushed together now. It's disgusting. And so these families are crazy. That's why they need your help, because they're trying to keep their kids alive, their older family alive, and maybe themselves as well. And you can help them. So when a patient's recovering from COVID-19, they need to keep isolated. I keep saying that, and they need to use all these protective measures. Ideally, they need to have their own room. That's why it's better to have them in their own place and their own bathroom. So it's really not wise to move them, but some families will, and you have no way to handle that. They can't have any visitors because they actively have COVID, and pets need to be kept away because pets can get COVID. Who knew these things? And all of this is in the research that you can do on the web. And visiting can only be done through technology. So and this isolation, isolation that causes depression, by, especially this person who has to, not only has to isolate, but they have COVID, you need to ameliorate it in some way. So honestly, the first thing is food, because, they probably won't have a lot of hunger, but you need to really entice them into eating because they're sick. And it's a distraction from the loneliness. And so, these are some tips, and you can get this from, the COVID sites. You need to create a pleasant eating environment, even if it's only a half piece of toast, that stimulates people. And you can do that. And this sounds like Martha Stewart, but you know what? She's useful here, to, have a nice placemat, a table setting. Get out the silver. You never use it, and their kids don't want it, so put it out there. A folded napkin and a flower. Now, I'm not even kidding here. You need to make it attractive and to eat. And you want to talk about food, and especially about what their mother, and that's why I have this 40s mother down here, because usually, I grew up in, I was born in the 40s and 44, and my mom had a refrigerator like that, only we had ice up here and had an ice man every day. What did they make that their mother made that they loved? And really listen to this and try to see if they remember the recipe, and if not, look it up, because that, and this sounds trite, but it's important, because food can be a real help. And a lot of older people have special diets because they have comorbidity. So the anxiety and confusion of COVID, needs to be ameliorated it's really not ameliorated. You need to take care of the special diet. So you need to follow the steps of the doctor and the prescription of the doctor for whatever food they're, if you're diabetic, for instance, you know, if you can't eat gluten, I can't eat gluten. You know, all the meals need to be prepared that way, or delivered or ordered that way, and then identify the foods that you need to buy if you're going to cook them, and be specific about what's avoided. Now, why am I telling you this? Because everybody's got to eat, and you're going to tell the family how to do this. I'm giving you procedures. I'm not going to go through this, but this is like a full-on procedure. So, grocery shopping. What, you know, literally what you want to do is, if the, you know, adult child is going to shop themselves or get somebody to do it, they need to shop for 2 to 4 weeks. That's really important. They won't have to go to the grocery store that much. Now, obviously, wear a mask. All stores now, thank the Lord, require it. Or they can order food online. And all this needs to be in here for you to tell them and for them to have. And they could even get groceries for a month, which would mean that they'd make a whole, you know, menu for a whole month. And identify perishable and non-perishable. Out in California, I don't know about the rest of the country, but we have so many farmers that use farmers markets, and you can actually get fresh vegetables delivered if you subscribe to that. Or just go out and get them at the grocery, and then, you know, go to Costco, because Costco will deliver if it's a non-perishable. And or you can, you know, they could hire a care provider to do the shopping for them. And again, you have to follow all the CDC guidelines to unpack the food. So this is a procedure you need to put in there. And I'm going to do a second poll now. I know it's maybe bothersome, but it'll give everybody a little breath.
All right, and we should see that poll should be available to you now. We'll wait for some of the votes to come in. Do you want a webinar on marketing your COVID-19 service? Cathy, while we're waiting, let me ask you a quick question. Do you know if there's any, are there any specialty areas, certificates that are in line with this type of expertise in infection control and COVID control? And
not that I know of.
It's sort of aging in place now. What we're doing is we're aging in place, but we're aging in place around this COVID thing is what we're doing. You know, we're
yeah,
right. We're manipulating everything so people can age in place. Right?
Exactly.
So we're taking a large concept and now we're reducing it down to a microcosm of what aging in place really is. That's because that's what we're doing, at least for the time being. But so the answer is that you've not heard of any kind
no,
of
I
haven't either.
I just did it. I didn't, you know, I didn't find anything, so I made it up.
Okay. Let me share the results of this here. So we have so we have the majority, everybody that voted said yes to.
Okay. Well, that seals the deal. The next webinar that I do, probably in about 2 or 3 weeks, I'll show you how to market this, because I designed that as well. Okay, let's move on. Oh, shut up here. Okay, so this is product number 4, and that's the COVID-19 procedures for the discharge. Now, this older person, has contracted COVID. They've gone in the hospital and they're now discharged. So this is your 4th product, and it does take very, very different procedures. So you have to show the adult child how to arrange transportation home. And, you know, I've got a lot of it here. You just go to the discharge planner, or you can do it for them. GCMs normally do. And Medicare will usually cover it, but you have to have a doctor's written order for it. in a non-emergency, which would be a discharge from the hospital. If they're in, it's an emergency, Medicare will still pay if it's a non-emergency, but you need to give them all that and explain it to them. I'm just doing a fast flash to you. As you well know, a Medicare home health agency can follow under Medicare if somebody's discharged. So they're going to come for at least a whole week, and they come daily, and sometimes it's interspersed with telephonic telehealth calls. I know this because my husband was just hospitalized for open heart surgery at Stanford. But you're going to explain it to the family in terms of, procedures. And the GCM visits at the same time because you can co-visit with the home health agency and, manage the family stress, etc., and make sure all these other procedures are set up. And you can do yourself a health and psychosocial status as a baseline to pick it up, because GCMs pick up after Medicare home agencies go out, and they go out really fast. They'll have PT, OT probably at the last. And then you got to set up the room, and the room setup is completely different when somebody's discharged with COVID. It has to be as bare as possible. You have to disinfect all the high touch surface areas over and over and over again. Have the usual masks, hand sanitizers, wear a mask and gloves, and you have to align trash can just for that person because they could spread it. This is only the tip of the iceberg. I put this in, but the procedure would be longer. And buy a baby monitor if you have a caregiver. Hopefully you will have a caregiver staying over. And then you get into cleaning and disinfecting. You should have a whole procedure about that, because cleaning is just removing germs and dirt and impurities. Disinfecting is killing germs, and you can see down here these little pointed guys. They're COVID virus, and you want to kill them. And so you have to use antibacterial, antiviral solutions, and you can just go on the EPA site and they give you a whole list, and you can give it in a procedure to the family member. Unless the long distance care provider moves in, which in general they probably don't, but if they do, when the older family's ready to be discharged and returned home, you have responsibilities about staffing. So somebody, usually before a discharge, you have to figure out staffing. Do they need staffing in the house? And if so, you can be the agency if you do, either have staffing as part of your agency, or if you you contract with the home health agency you think is really great. And so you need to be part of the discharge. So you got to get care providers in place unless the family's going to do it. And these are, I said I would do this for you. These are the parts of a geriatric care and management consultation that you can do and what you can offer these clients. Personal care, we all know this, bathing, eating, dressing, so you can hire care providers to do that. Household, that, cleaning, laundry, etc. Healthcare, you're going to have medisets or have a nurse come in and set up the meds, but arrange telehealth physician's appointments, because they really don't go to see the physician with COVID. PT comes in just under home health, but they might extend it. So they're doing PT through telehealth right now, and that's just been extended in this new order. And then wound treatment, you'd bring back the home health agency because they can bill under Medicare for that, and medical equipment. So they need all of that. And then emotional care, which is companionship and conversation, which would be the adult child. You can do the top three and advise about companionship. And these are just the basics, and you need to give to the person who's recovering. They're mostly in bed, so water, sleep, warm, monitor symptoms. And then keeping the older person socially connected, again, very, very important. So, one of the technologies you can use is GrandPad. There's a lot out there, but you need a simplified tablet if a lot of older people are not tech literate, or a lot of people are too, but you have to find that out. And GrandPad has large text and buttons, etc. But that is a way for them to keep socially connected. Jitterbug, I love the Jitterbug phones, the Flip or the Smart 2. And as I said, it has a built-in emergency button. So that's great. But that's another way to stay socially connected. They can call and talk to their friends or take calls if organize friends and family to call them. And you can even do things as they get better, or even with the sheltering in place people. Libraries are open now throughout the country, and they have online book clubs, which is, how did, these people grow up as children? They read. They didn't, well, they watched television in the 60s, but used to listen to the radio in the 40s, believe me, because that's all we had. But, that's another suggestion that, the adult child can get them involved in. And then you can get them involved in tech-free social connection. As they really get better, they could take a class at a local, because all the classes are now online. You could take a class, or when they're recovering, subscribe. This is AARP. They have free online games. That's the link to it. Subscribe to Audible. Audible's great, and you just put buds in, and the older person's off. Identify what the music that they love and make a playlist and put it on the iPhone or whatever phone you're using. And if you're interested in art, which I dearly love if I ever get COVID, there are tons of Google virtual museum tours that are for free, that are fabulous. Any great museum in the world, and that's something that would really, just take a person an hour to get through, and it's wonderful. And if you have an older person who loves to play brain games, Luminosity is designed for older people, and you can check it out there on that link. So these are all social connections to keep them happy, to keep that boring time, that depressed time. I mean, sitting in bed for a long time is really hard, especially when you feel like you're going to die. So you've got to build social connection in here. And here's free tech social connection. They can write letters. I still write letters, but give them some nice stationery, and you find their address book, or give them one and write everything in for them, or use the mail as a surprise way for loved ones. And there's this I used this when my husband was in the hospital. There's this great app called Caring Bridge. I highly recommend it. Where you can organize family and friends to do what the older person needs. My husband loved the cards. And so, these people sent cards. All I had to do was put it on Caring Bridge. And we did meals the first couple of days when we came home, because I was kind of overwhelmed. You can get jigsaw puzzles. Everybody's doing puzzles again. You can enroll them in Senior Center Without Walls. You should know about that. This is it's a program where they read books online. All you need is the telephone. And then Storyworth, I would highly recommend. My daughter gave that to my husband for Christmas, and Storyworth is fabulous. It's reminiscent, but all you have to do is each week they give you a prompt. You print it out and give it to my husband. He writes it out by hand. Like he used to be a highway patrolman, so he has, great stories about that, and wrote it all down. And this is, what you will find is when people die, why didn't I ask those questions? This is a way to ask the questions and you really get it. And that's, older people love reminiscence. So this is a really wonderful program. I highly recommend it. Or again, subscribe to Audible, and all you need is earbuds. But you've got to show the adult child that they need to just create joy and happiness and social connections. We're social animals. We are at the end now, and so I'm going to go through these offers that I always do at the end. And my first offer is the Geriatric Care Management Manual that I've had out for 12 years. It'll be now out today in its 5th edition, and it has all these COVID products that I put together already. I've just taught you how to do it, and you can do it by yourself, but if you don't want to do that, I've got it, and it contains all of these plus the older person in the hospital and sometimes dying, which is really hard to take on. And I have that as well. I didn't include it today. And the benefits of the operations manual is you don't have to do the procedures for yourself. Somebody will do it for you. You can start your own aging life or geriatric, restart your care management agency with 15 pre-made products. And the reason I always talk about products is don't say you do assessments. Nobody knows what an assessment is. They barely know what a geriatric care manager is. What they know is they have a specific problem and you should answer it. They want to move their mother. Their mother has COVID. Their mother's incredibly depressed. She needs quality of life. The mother's going in the hospital. You need home from the hospital. They're all in the manual, step by step, how to deliver them. You can effortlessly onboard employees because you don't have to be there. It's all in the manual. And then it's easy to open a second agency with an operations manual with any business. They all have them because mine is written with gold standard procedures. And so it's easy to train because the procedures they go from, people from the head honcho, you, down to the care manager, down to the care providers, and it makes sure that the gold standard gets passed down. And it offers risk management, so you avoid litigation, which of course you want to avoid. These are all the services that are in there. I'm not going to go through them, but these are the 15 services. And there's a second manual with all the forms. They're all electronic. You can, manipulate them, change them, throw out what you don't like. I put in there. And it's usually $8.99. You can have it for $7.99. You are licensing my intellectual property, so you have to sign a contract about that. And that offers there until the 14th of August. And the second is the online class, the people that really got me to do this program. The class is normally $9.95, but it's $8.95 for the webinar. And you get the manuals for free with that, plus the class. And the class goes through all 15 products that I teach you with 20 hours of free consultation with me. And again, you need to sign contract. I need to sign contract, and you can email me. And then, these are the benefits. It's self-paced. You only have a year to finish it. I used to give them a long time, but they dragged it out too much. And I felt like I needed to have some incentive to feel it. So you have 20 hours of free consultation with me as part of the class. You can use it in the class or later. The 15 products and 20 PowerPoints, because actually it's 25. Home from the hospital is 3 PowerPoints, death and dying is 5, and COVID is 6. So you have 26 PowerPoints. And tools. I'd never give you anything that I don't have a template for. So if you're going to do a financial forecast, I give you a financial forecast. It's not yours, but if I give you I tell you to do a business plan, I give you a business plan. It's not yours, but you have something to follow. That's my means of teaching. And the features are, there's a marketing PowerPoint, there's marketing with each product. So you learn how to market the product along with deliver it. There's exercises to teach each to sell each of the 15 products in marketing. There's a closed Facebook page just for people that own the manual, and there's a lot of them. There's a required chat room, which is normally in Blackboard every 2 weeks, and bibliography and syllabus and CUs from, if you're a social worker, from the ASBW or NACM, which, a lot of people belong to, and that's coming through now. And the benefits are you get the manual for free. It's only $100 difference, a great deal. You get marketing material to be able to market all your products, and it makes the agency more scalable so you can open a second agency. And you save money on your staff because it's a training manual. That's what it's for as well. So you can train your staff right through the manual. So you can take vacations and they know what to do, and they're going to do the right thing. And if you're ill and sick, you can stay in bed because the manual is a way for the agency to run by itself. Not totally, but you stay in bed when you're sick. And you can sell your agency for double the price if you have a manual, any product. If because it's turnkey operation, you can travel the world if you want when you retire. You can't do it now, but maybe COVID will be over and you can eventually. And the third offer is for the business online class, and that's for people who are starting up or people that are restarting. It's normally $650. It'll be $550, and these are all the modules that I cover. It's soup to nuts. And it comes with 10 hours of coaching from me, an hour for each module, CUs, the same for the other class, and free tech support because I have a tech assistant that helps with Blackboard. So anything that you get stuck with, Tanvi will take care of it. And you'll get 10 hours of free consultation. If you're interested, you just email me. And if you already have the manual, because it's in its 5th edition now, you can have the manual for $300 because you've already got the manual and bought it from me. And so with that, we're going to end. This is how you can connect with me if you want. I have a YouTube channel. You can see me age in there. I blog almost every day. So you can, and I've been blogging a lot on COVID. I have a Facebook page. You can subscribe to that, and a website, and you can follow me on Twitter. So now we'll take questions.
Thank you, Cathy, for another information-filled presentation, as always. There's a lot of information, like I just said, that you let's give them a minute or so to digest a little bit, especially at the end there. But I did want to make a comment on what you were talking about regarding people at home, I guess, essentially, or anybody that's going to have people coming in and out of their residence. And I would say mostly at home, people living at home that are going to have delivery services are going to have, but mainly the ones that you can control, you meaning the care manager in a situation. So I'm talking about like home health agencies, companion services, anybody coming into the home on a consistent and regular basis. I would stipulate to these agencies that it needs to be, whenever possible and always possible, the same person coming in to reduce the risk of various different people coming from various different sources, bringing in what you don't know. So if you have the consistent people coming in, if it's Joe Jones coming in doing your physical therapy at the beginning, Joe Jones should be the only one coming in doing your, other than maybe the initial eval or something like that. That's that's around it. But consistency of the provider, I think, is very important to minimize and to trace. Right, so who's coming in, and you're not having 3 and 4 different OTs and 2 or 3 different PTs, and maybe 1 or 2, 3 different nurses along the way.
No, I totally agree. That's a really good idea, and that's why I'm saying that every agency, they should have had it now, needs to have safety protocols, and it should be up on their website now. It's the safety protocols for your own staff. Most people have skeleton staffs, but most people are they can either they contract with a home health agency or they have them. And I believe that's really true about not too many people coming through, because in nursing homes, they've found that the highest rate of transmission is from the care providers, because they
Yeah.
get so ill paid that they have 3 jobs.
Yeah. Yeah. Well, yeah. Yeah. There's a lot of dynamics going on behind that.
Yeah.
But to a smaller degree, having people come in, and I guess that would apply to the care manager too as well. And you would have to take precautions yourself on going into, I
Oh
would
yeah.
imagine, regular testing if you can get it, if you can get the results back
That's
in time.
the rub.
I mean, there's a lot.
Santa Cruz, which is the smallest county in California, it's 10 days to even get a test, and another 10 days to get it back.
Mm,
And
yeah,
they're free, but you could die by then.
that's just not workable. You can't, if you're going to go in and see a client who, if you're here in Florida, you can't even go into, I don't care what kind of agreements or arrangements you have with anybody, they're not letting you into, or they shouldn't be letting you into these facilities here in Florida.
No, they're not here either.
Yeah,
Nobody can get
I've been
in.
banned from going in, right? Even though I pled my case, I still was not allowed in. And we are
Yeah.
getting some questions in here, so let me jump over to the questions here. Okay. So we have a question. Question here number 1 is, how are each of the products you discussed priced? And the second part of that is everything billed hourly, or do you recommend any flat fees?
I don't recommend flat fees ever, because you could end up consulting with these people 6 hours. I would say that I would just charge your own hourly rate and keep track of the time, and be like an attorney. Turn off at when that hours, if they've gotten 5 hours, if they've prepaid 5 hours, then stop then, and they need to re-up the amount of money that they have with one hold with you. Basically it would be in your bank. But I just am, again, flat fees. You're gonna, people will take advantage, and I would not do that. And use, each part of the country has, both coasts are relatively expensive. Care management's not expensive, but it could be $200 in New York, and the Midwest it's more like 90 or 100. But you've got to go with what the traffic is going to bear.
Yeah, you would do, and I would say another reason to add to that, to keep it hourly, is because things change so quickly and so rapidly that you want to manage that more closely. You want to keep that close by you, rather than having you could use let's say if you put a $500 flat rate, let's say for a month or for whatever, you're going to go through that in no time if you have a seriously ill person that you're.
Exactly.
If you look back at your presentation, all those services that you mentioned to coordinate that kind of care at home, if somebody's going to stay at home and they're sick, even if they're not, deathly ill, but if they have some symptoms, that monitoring on that person is going to be, you're going to have to have some intense monitoring on that, and some intense understanding about what's going on.
Exactly.
What to expect.
Exactly. And you're going to have to do some sort of initial assessment. I wouldn't say a lot, not a full geriatric assessment, but you're going to have to talk to them and find out what the story is. What is their situation to help? They'll already know, where their parent is and what they will want. But again, I would just charge my hourly, and I would keep, have a time tracking app. You should have one already, and explain that in the beginning and have it in a contract.
All right, thank you. Let's Marcia ask a couple of questions here. She's asking, you talked about prepayment. Should we replenish the retainer 30 days before reaching the end of the money?
I would agree. I think that I know who that Marcia is, and of course
okay.
I would say yes, you should.
Okay.
Thank you, Marcia.
There you go. And then, how is this best handled in a time when people may not be able to pay their bills on time?
That you're going to have to figure out. I don't know. You're going to have to figure out
Yeah,
if you can do a sliding scale. This is really tough because,
yeah,
care managers are, and the exact reason that I did this was because care managers, like everybody, were struggling with their businesses. So, it depends upon whether you can afford to do that or not, or, I can't make that decision for you. Um, we're still, if we had Medicare for all, it would be different, but we didn't want that. And so I would just say that, I would really look at your own position. Like if you got a PPE loan and you're in good shape, maybe you could do that. Um, but if you did, it's probably run out. The money's gone. You already spent it.
yeah. And
Not
with
not lasciviously. I mean, you spent it because you helped your staff stay on.
and we still don't have another stimulus passed, and now unemployment has stopped. So I think we're looking at some serious financial issues with a lot of people.
Terrifying
Even
financial
even
issues.
right, yeah, and even with people, regardless of the COVID group, and I'm not saying that lightly, but even with our standard regular care management business, we're going to have to. I think we're going to be looking at people approaching us to say, listen, we love to care that we've been with you 6 years, 10 years, whatever it may be, but the situation now is this. We've had a financial crash, right? So I looked at my latest statement from what I've got going on here, and it's about half what it used to be back before, back at the
Yeah.
end of 2019.
Right, and
So
most of the people you serve are going to be in the top 10%, and
and
that's what they
so they've
depend
got a
upon.
lot of losses there going on. So I think you're going to have
Right,
have people look at that as well,
right.
in addition to the medical aspect of it. All this is going on in the background, and people and let's face it, care management is wonderful. I am one, so I know what we're capable of doing and what we do every day. But to some, it may be on the border of a luxury or a border of whether or not it's this or something else. So
Well, that's why this is a wonderful program because, it's adding a new business, a new segment of your business. It's allowing you to diversify, and it's just consulting with telehealth. And, that by itself could be affordable if, you're, say $600-700. But you could do a lot of business with that. It really depends upon how you market it, and how you that you do a really good job in just what I told you, that you research it really well, and that but it will be a great asset to you at a horrible time, and more horrible times are coming. Any more questions?
oh yeah, yeah, they're rolling in now. We got quite a few, so we have to maybe step up the answers a little bit here. I think I'm going back to. I was just reading here. I was just referring back to. So there was a question regarding pricing, and I tell you what, like in an effort to move on, I'm going to go on to the next question here because we sort of more or less tried to address that one before, but we'll come back
Okay.
to that first time. Again, Marcia's asking a question: are contacts best done with the adult children or with the elder person themselves?
I
Vice
would say
versa.
95% with the adult child, as the only time I ever found you really ran into the older person was when they were pre-planning. They were, and more and more that's going to happen. But I think you could the elder person could call you, and
Oh yeah, sure.
and you should be able to do that. I mean, that's what you are, a geriatric care manager. I mean, you were just, I think we're all born to do that. And they're probably easier to deal with than the adult children. But I would say, probably maybe 5% is my guess. And it depends upon how you advertise this. And, I will do a whole webinar on marketing this. I was thinking in 2 weeks or 3 weeks, depending upon when Keith's available. We don't need to talk about that between us, but I can put that together, but you really need to market it to then 2 markets.
All right, let's get to let's.
Just as a tip, the easiest way to do it now is through an e-newsletter. So start thinking about that. That's really what I advise. And if you ever follow my blog, which you should, you know, I talk about COVID constantly now because I'm obsessed to, want to keep older people safe and protect them from who we won't name. I think an e-newsletter is your easiest way to begin because it's a technological way to get there.
Let's. I want to move on to this next question because it's a good question. Well, they're all good questions. So this is from Catherine. She's asking, how do you get the same person from an agency? So I think she's referring back to what we discussed earlier about trying to get the same person.
You demand it. If it's your own agency, you can do it. But, what I say to geriatric care managers is you only contract with a home health agency that's going to meet your needs because you're co-supervising. So they have to, they have to go along with that. They have to go along. I mean, and if not, don't use them. I mean, they have to be a really good agency. They need to have all the health standards that we've been talking about, masks, blah, 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 take temperatures. They need to be able to co-host, co-manage with you. And, I have a whole form to do that. But I would demand it. You want gold standard.
And I would think too, if I'm an agency, and I'm not, but if I was, I would think, wouldn't the same principle apply? Wouldn't you want your staff to go to the same houses to visit rather than sort of jumping around and going to various different places? I'm just thinking in terms of, and I know that's difficult to do. I do know home health agencies and sort of how things change during the course of their treatments to their patients. But I would think, and maybe in these times that I don't know. I would have to. I don't have an answer for that, except to think that if I was an agency, I would try to keep that same pattern going with my employees too.
Yeah,
So,
I would say, be tough. Yeah. Have standards and stick up for them.
Okay, let's go to this question. Yeah, we got a few more coming in here. Okay. Somebody missed the first 25 minutes of the webinar. Yes, there's going to be the recording. You're going to get the recording once we have it available. Cathy will get it and put it up on her website, Cathy, in the next day or two, 3 days, something like that, right?
Hopefully by tomorrow I'll have it up.
Yeah, don't be knocking yourself out. Or
Keith, we both
I'll
record
get it to
them.
you. Yeah, you'll have it, and it'll be up on the website in the next, let's say, 2 to 3 days, so that way in case there's a issue or glitch or something, then you would be able to overcome it. Okay, yeah, so there's that answered. Should have probably said that up front. Sorry about that. Next, this is from Marcia. With case management done remotely, does the case manager visit using a tablet or cell phone and working with the caregiver to view the home and elder's room?
I would say that you and the agency have the procedure to do the room, and the caregiver would set that up. But you have very, very specific, because this is COVID. It's highly infectious, so very specific ways to step by step to do it, and you would certainly consult with the adult child or the older person about how it's going to be done, but the actual setting up would be done by a care provider.
But let me see. Let me read it again. I was just looking at it, and it's does the case manager visit using a tablet or cell phone and working with the caregiver to view? That's the part.
Oh yeah, absolutely,
absolutely.
Room. At the end, yeah, I would. If you have to negotiate all that about the home visit, but and show to them that you're tested, and that's why I say you need these protocols. But it's probably a good idea to go out and check. Yeah, monitoring should occur. I'm not saying doing everything by telehealth. I mean, you may, if the family or if your staff doesn't want to go out. I mean, I know a lot of staffs that don't want to go out, or families don't want you in. But if you can prove to them that you're really safe, and you do have care providers out there, and you certainly would go out if they'll let you in.
Well, what would be the, is there an issue, or would there be an issue if the client themselves were to say, so here, let's pretend you're the client and I'm the care manager, and so I'm asking you, so what have you had to eat today? And your reply to me was, oh, I had, whatever some meal was that I knew, because I know you, that wouldn't be possible. So I'm asking you now. I said, I'll tell you what, take your little phone that you're watching me, that we're talking on, and take it over to the refrigerator and show me what you got in the
Yeah,
refrigerator. That
that's
type of stuff. What is there boundaries around that? Is
no,
that
no, no.
part
I
of
think
this?
all of that can be used. I mean, I'm old school. I started doing this in 1983, and we had everybody chart exactly what they were doing. Your charting should have meals. It should have exactly what's in the meal. I mean, if you have really excellent charting, you can look at the charting and find out. But, it's much easier today. You could just show them with your phone.
Yeah,
And,
okay. Yeah.
especially if you have technology set up in the house where, in some cases you do, where actually you can look in the house. That's set up for care providers, home monitoring.
Okay.
But not everybody, has that and can afford it, so you could do your phone.
Use your
But
phone or your.
I would definitely have the care providers chart,
I think the
because
GrandPad too has
you
a
can,
camera.
yeah, GrandPad can do that.
Yeah.
But you never know. I did it for 25 years. You can get dragged into court with, you didn't do a damn thing, but they're fighting and you've got the evidence. So you submit your charting, and you teach people, you teach your workers to chart really well.
All right. I hope I'm saying this right. Kyra is asking, are GCMs going into homes to do initial assessments or trying to do most of their work by phone with new clients? Are GCMs going into the homes or doing initial assessments to do are they doing initial assessments in the home or by phone for new clients?
From what I can see on the listserv in ALCA, I would say probably a third are going into the homes and
Yeah.
2/3 aren't.
And I think it's a mixed. I think for some parts, people are having to, like you mentioned earlier. You almost, if you want to get a look at the bathroom, if you want to see somebody really transfer well, it's going to be hard to do just remotely. You would have to go in, and ambulation would be hard to gauge. Mobility would be hard to gauge through a teletype thing, unless you put the phone across the room and had somebody walk across. I mean, it gets getting a little complicated then. But I think there are some procedures that you would need to see in person. I would like to see the house personally myself. I would like to see
Oh,
the outside of the house, and the property and what's needed, garage.
well, that's the problem. When I was talking about our new normal, is, our old way of doing things as care
Yeah,
managers is obliterated. That's the best way. But, now you have people that are afraid to let you in their home.
yeah,
So
yeah.
you have to figure out a new normal. And I think the phone is really a good way to monitor as the new normal. If you're yourself the agency director or the care manager who's in charge of that client, can see it. And I think a really good thing if you belong to ALCA is watch the listserv, because you can ask that question of the listserv and you'll get a whole bunch of answers and find out generally what people are doing. But I do watch it, and you know, I would say it's challenging right now to get into homes.
Yeah, and like we already talked about facilities already, so getting into a facility, and
Yeah, you
you
can't get
have
into
to do it right. It's
facilities.
got to be all through telephone, and they've been, to their credit, they've been very accommodating, or as accommodating as they can be, to allow for family members to contact their loved ones within. They
Yeah.
have bought or provided for those types of grandpads and different types of devices where they can or some types of phone, the things where they can, share them
Mm-hmm.
with people. So, to that end. Uh, oh, thank you. Let's see what Rachel is. Rachel wrote, thank you for the excellent class. I have a client who is pro-president, I guess pro-president views or voice. Has a husband who lives in assisted living, cannot see past the fact he should be able to leave, blames everyone, and that the president is not wrong. Okay. Doing my best to stay education focused, but she cannot seem to look past her anger and not stop the blame or blaming. That is the home's fault and not the president, and that the president is not. That it is the home's fault and that the president is not. Any thoughts about? I'm not sure. If that's a
That's
political, I'm not
everybody's
going to.
problem. I
I'm
don't
not
mean
going
to
to.
diminish this, but
If you're
that's
talking
mixed
about a
messaging.
political
That's
answer,
that's exactly what I'm talking about, because she's dealing with a mixed message. And I really don't have an answer for that. I mean, that is the problem. The country's divided about even wearing masks. Um,
yeah,
and it does leave people frustrated and angry, like clients, because they're in a terrible situation, and many are so distressed, or they have a history of blaming, they want to blame someone else. And they watch Fox News a lot, so they believe the president. I don't think you can get them to stop watching Fox News. Um, I personally had my son-in-law's grandfather, who I adored, great guy, was an artist. He watched Fox News because he was bored, and you couldn't talk him out of that the Muslims were all killing babies. It's very hard to change opinions at that point, because they are stuck in the old reality, and this is the new reality.
and to your credit, Rachel, you're doing, in my opinion, you're doing the right thing. You're staying education focused. You're looking at the information that's coming out that we know is reliable, that we know is accurate, that we know is provided for us, and you do your best to educate others in that way to the best of our ability. But again, it comes down to choices. It comes down to personal choice and what people want to believe. Wear a mask, don't wear a mask. But having all that, as long as they understand the risks and consequences, it's no different than other things that they're taking risks on. People smoking cigarettes when they're on oxygen. So yeah, that kind of stuff.
through
So
the through the through the holes in there. Oh God,
yeah.
I've
So
seen that.
you're doing. I think you're doing your best to keep positive in what you're in your message and keep focused on the truth and what is fact out there and do your best to minimize the consequences of their ill thinking, wrong thinking. I don't want to judge on anybody. It's up to them. Your own personal.
Yeah,
It's when it crosses the line and it affects me is when I have an issue with it. But if somebody's in their own home, they don't want to wear a mask, they wouldn't need to wear a mask unless somebody comes in. But even in that case, that's an interesting, right? What if somebody does come in and they say, it's my own home, I'm not going to wear a mask, and I'm trying to perform therapy, or I'm a nurse trying to look at a wound or something. Where's our responsibility end for our client? What if you're a GCM and you're coming in and say, hey, I need to ask you these questions, and they're not going to wear a mask, and you're 6 feet away, they can't hear you, whatever the reason,
yeah, that's a real tough one, and I think you're going to find a lot of older people that are Fox News watchers, just to generalize them. And if they've hired you, then you have half a chance of trying to cajole them into doing the right thing. But if they have the capacity, then they have the right to do the wrong thing, and you just have to work around that as best you
yeah,
can.
yeah. Okay, back to yes, the information. Where do you post your these webinar recordings? Where do you put the recordings, Cathy?
They'll come through Constant Contact. They always do,
Okay.
and I post them on Constant Contact with a post that you know what I'm doing, and it should come directly into your mailbox. because I already had, because you signed up for the webinar, I can break out the name from Zoom and send the contact list to Constant Contact, and you should get it. Everybody that signed up, whether they were here or not, gets the webinar.
Okay, all right.
And then I will announce the next one. Now that I know that people are interested in marketing, I will announce the next one. But just as a hint, an e-newsletter is really the most important thing, and you should really start thinking about that. That's Constant Contact, SurveyMonkey, and there's a number of other choices. But it's easiest way to get the information out, because you can't see people in person, or Zoom webinars, and I will show you how to do all that.
Okay. Okay, let's see. We have Charlotte says, thank you. This has been so helpful, and she needs to go and deal with a client. So there's that. And Rachel says, thank you so much. Keep sharing them. I keep sharing them with, this is CMS rules. Yes, I want to keep them healthy and focused. Beautiful. Good job. Yeah. And NIH is another excellent site. And even some of these major universities, they're putting out some really good research, some really good stuff that they're coming up with. Some of these trends and things are really fascinating. It's not, I wouldn't take them to the bank, and say, hey, this trend on, with the populations and certain populations and things like that. I don't know.
Yeah, I mean, what this has done, since the federal government has not responded, has, just what I was talking about in the beginning, it has spun off cooperation. And so their university, not the University of Michigan, I think it's Michigan State,
Yes.
they were on the Rachel Maddow show the other day, and they figured out this way to do massive testing of taking spit tests, for COVID, and doing multiple trials on one batch, which is less expensive for universities, to be able to get tests back in about 2 days. And what they were talking about is, if you got all the university and college laboratories together, they have all the abilities, and they're just, they're down now. They could really come up with great innovative solutions. So, everybody's, that's what change is about. You've got to, think up, and you go with a change, and this is a change. It's a change for geriatric care management. It's a change, but it's a way for you to really deliver compassionate care and answer a need, at the same time, have an alternative way to make money. So I really hope you think about it and, implement it in your business, because you never, it could, what's COVID, what would be the next thing? Life is filled. The Depression people never thought, that when that went away, they thought, boy, we're just doing great. And 2 more years, they had World War II.
Yeah.
So I'm not being, sort of depressive. I'm just saying that, you've got to go with what's going on in the world and change, and go with the change. And this is something for you to do.
All right, so we have a lot of thank yous here, and thank you everybody for your comments.
Oh, really? Thank you. Great audience. I wish I could see you.
Great questions. Good, lots of good, and Catherine and everybody. Rachel, thank you for all your good comments here. And the slides. Will people get a copy of the slides itself, or just this, or how does that?
They'll get the whole webinar. It'll be the slides and me talking and you and I talking. I mean, the whole thing will be there.
Okay, I'm not sure if they're a copy of the slides. I'm not sure if they mean the actual physical.
No, I don't know that. No, they'll just get the recording, and the slides will be in the recording. You can't use them, but you will get a recording with the slides and my voice and Keith's voice. And I used to post them on the YouTube channel. I might start doing that again, so that you could, you could view it again.
Yeah, just for general public too, because it's got a lot of good stuff in here, right? So anybody would be able to probably see that.
Yeah, and if you're going to the Western Regional yearly
Is there a
meeting
conference?
in September, I'm going to be the main speaker on this. So
Oh, all right. So you're
you
gonna be there in
will
person
you can
then.
hear it again and
They're
meet me
gonna
in
have
person.
something. They're gonna have something in
Well, you can't
September.
meet me in person; it's all virtual.
Oh, all right. Okay, but you'll be presenting then. At the
Yeah, they
Alco
just called me.
at the
Yeah.
national conference you're talking about, or
No, no, no. This is
Southwestern
Western Regional. No,
region? Okay,
I didn't apply to speak at at
okay.
the national one.
All
I
right. Since
thought
there,
Florida would be too hot. I never realized it would be hot with a hotbed of COVID. I
yeah, it's hot
definitely
already down
wouldn't have
here.
come.
Oh my, it's well. Listen, we're running over time here, so I just want to say
Okay,
thank you,
thank you
everybody. Good night.
all.
All right.
Have a good
Have a good
night,
night.
everyone. Thank you for your attention.